You know, there's a part of your body you probably don't think about much. Well, not until it starts screaming at you anyway. And that's the meniscus. It is the absolute unsung hero of your knee, and really understanding it is the key to keeping you moving. So let's dive into what it is, why it's so incredibly important, and of course, what happens when it gets injured.
Yeah, if that question hits a little too close to home, then you are definitely in the right place. That sudden, sharp pop is such a classic, and honestly, pretty alarming sign of a meniscus tear. And it's one of the most common knee injuries out there, for everyone from pro athletes to weekend warriors.
So, what exactly is this thing? The easiest way to think about the meniscus is as your knee's own personal, built-in shock absorption system. Seriously, without it, every single step, every jump, every turn, it would be a jarring, painful experience for your bones.
When you really break it down, the meniscus is just elegantly simple. You've got these two tough, rubbery pads, and their main job is to cushion the joint. They absorb the massive forces that go through your knee every single day. They sit right there, nestled between your thigh bone and your shin bone, protecting the cartilage on the ends of those bones from getting worn down.
But here's the thing, you don't just have one, you have two in each knee, the medial on the inside and the lateral on the outside. And the way they're designed really explains why one gets hurt so much more often. The medial one is C-shaped and it's anchored down pretty tightly. The lateral one, though, is more O-shaped and it can slide around a bit. So think of it like this, the medial meniscus is on a really short leash, while the lateral one can move more freely. When you make a sudden twist, that short leash means the medial one just can't get out of the way fast enough, making it way more likely to get caught and torn.
And this gets right to the heart of why these injuries are so incredibly tricky to treat. The answer isn't really about how big the tear is, it's all about its location. And location, well, that determines one absolutely critical thing, blood supply. Okay, so healing potential boils down to these three zones. The outer third, what we call the red-red zone, has a great blood supply. That means it has a fantastic chance to heal on its own or be repaired successfully. The middle third, the red-white zone, gets some blood flow, so healing is possible, but it's definitely not a guarantee. But that inner third, the white-white zone, has almost no blood supply at all. A tear there simply cannot heal itself. It just doesn't have the biological tools to do the job.
And you know, it's not just about shock absorption. The meniscus is a total jack-of-all-trades for the knee. It distributes your weight evenly across the joint, it adds a ton of stability, it helps lubricate everything with joint fluid, and it even gives your brain feedback about where your knee is in space. That's what we call proprioception. So losing a meniscus means you compromise all of these vital functions.
So now that we know what it is and all the amazing things it does, how does it actually get damaged? Well, the story of a meniscus tear usually follows one of two main paths.
On one side of the coin, you have traumatic tears. This is the classic sports injury, right? A sudden pivot, a hard twist on a planted foot. It's super common in younger, active people. Then, on the other side, you've got degenerative tears. These are the result of just, well, life. Wear and tear over many, many years. The meniscus tissue gets weaker, more brittle, and it can tear from a really simple movement, like just getting up from a chair.
And listen, a tear isn't just a tear. There are all these different patterns, and each one causes its own unique set of problems. A radial tear, for instance, is like a rip in a tire. It just messes up the meniscus's ability to handle force. A horizontal tear splits it into two weaker halves. But the ones that cause the most mechanical trouble are usually the bucket handle tear, where a huge piece flips over and literally jams the joint, and the flap tear, which creates this little loose piece that gets caught and causes a really painful catching feeling.
All right, so you've hurt your knee. What's next? Well, now it's time to play detective. We need to figure out exactly what's wrong, and more importantly, what to do about it.
The very first clues come directly from you, from your body. Things like pain right along the line of the joint, swelling that might not even show up for a few hours, that mechanical locking or catching we just talked about, or that awful feeling of instability, like your knee is about to just buckle. These are all the classic signs that are pointing straight towards a meniscus injury.
So, while a physical exam and your symptoms provide some really strong evidence, there's one tool that can definitively solve the mystery and give a crystal clear picture of what is happening inside that joint. And that tool is the MRI. It is called the gold standard for a very good reason. It uses these powerful magnets to create an incredibly detailed image of all the soft tissues inside your knee. With an MRI, a doctor can see the exact pattern, the size, and the location of the tear. And that information is absolutely crucial for deciding on the best possible treatment plan. Okay, so once that diagnosis is confirmed, the focus shifts to the road ahead. It's all about getting better and making sure this doesn't happen again.
So, there are basically two main paths here. For smaller tears or those degenerative ones that aren't causing mechanical problems, conservative management is always the first step. This means RICE, and that's rest, ice, compression, and elevation, along with anti-inflammatories and physical therapy to build up the muscles around the knee. But for those large, unstable tears, the ones causing the locking, surgery is often the answer. The goal is either to repair the meniscus, literally sew it back together, or if that's just not an option, to perform a meniscectomy, which means removing only the damaged part.
And this right here, this quote highlights just how much the approach to these surgeries has changed over the years. I mean, it used to be pretty common to just remove the entire meniscus, but now surgeons understand its vital role, and the guiding principle is preservation. Why? Because without that cushion, the cartilage on your bones wears away so much faster, and that leads directly to arthritis down the line. Saving the meniscus is key to protecting the knee for the long haul.
Of course, the best treatment is always prevention, right? And the steps are pretty straightforward. A proper warm-up, strengthening the muscles that support the knee. We're talking your quads and hamstrings, being mindful of your movements, maintaining a healthy weight to reduce all that stress on the joint, and using proper gear. These are all simple, super effective ways to protect your knees.
Ultimately, your meniscus is just an incredible piece of natural engineering. It's built to last. So the real question is, are our habits and our actions helping it do its job? Because thinking about prevention today can seriously save you from a world of pain and problems tomorrow.